Hi, this is Dr. Doreste with the Cranial Release Technique. Back with another video. It's going to be a short one today, something interesting. I recently got an email from a young gentleman out on the West Coast of the United States asking me about some health issues that he's dealing with and what is my cranial release opinion to what's going on. So we had a nice conversation, and towards the end he asked me a very interesting question. And the question was basically, well, hey doc, if you're saying that if I look in the mirror and I see distortion, cranial distortion, doesn't virtually everyone have that? I said, that's a great question. And the answer is yes. And what I mean by that is virtually all of us have this cranial distortion of one form or another. One eye will look smaller than the other, the actual orbit will look smaller than the other. One eye will look lower than the other. One ear may look lower than the other or more forward than the other. That was the one where you put your fingers in the ears. And if you're from New York, you know what a wet willy is. You'd wet your finger and put it in your friend's ear first. I teach that at the advanced class. We'll talk about that another time. You could take your thumbs and place them under your own maxillary arches, the cheekbones here, or your friends or family, and you will see distortion. One looks lower than the other. And again, the general rule of thumb, the majority of people will have most of that cranial distortion on one side of the face. The one eye will look smaller, the one eye will look lower, the one cheek might look lower, the one ear might look lower. That's all part of a pattern, but it's a global pattern. Remember, there's 22 bones that make up the cranium. So that doesn't mean that I'm only going to work on one side of the patient. We always work on both sides. We want to optimize and bring back the normal structure into the global aspect of the cranium and restore the primary respiratory mechanism. Restore this involuntary movement. So I said to him, yes, virtually everyone is walking around like that, and virtually everyone is suffering with this craniodural stress syndrome. This cranial distortion that leads to an osseous, the bones of the cranium are distorted. That's what you can see when you look at people. And if you don't see it in yourself, just put on TV. Watch the actors, the actresses, the newscasters. You'll see it everywhere you look. That's the osseous distortion or the bony distortion. That will lead to a bony spinal distortion. Cranial distortion leads to spinal distortion, leads to pelvic distortion. One of the pelvic bones will be higher than the other, right versus left. So it's a global distortion pattern. One of the legs will be shorter because of that, because of muscular contraction. That will then affect the dura mater. You remember that? The tough mother. The two Latin words that mean tough mother. The dura mater, the outermost covering of the brain, firmly attached to all 22 cranial bones, and then runs down and attaches into the pelvis. That will then lead to fascial distortion throughout the body. The fascia, the spider web of connective tissue that covers, surrounds, and supports everything in the body. And what we really want to do with cranial release is unwind all this, and we want to unwind it from the top down. That's just the way the system is built. There's nothing I can do about that. So, yes, most people will have cranial distortion. Yes, most people will be suffering from the effects of this cranial distortion, this craniodural stress syndrome. And the answer that we came up with here at the Institute is the cranial release technique to address this issue and let the body rebalance itself from inside out. And then if you do want to go in and give a chiropractic adjustment or massage or fascial release or Rolfing or deep tissue or acupuncture or whatever technique that you use, great. We've already set the table with the cranial release technique. We did that first. Just want to make a special announcement on top of that. Remember, December 2nd. So if you're out there and you're a practitioner and you'd like to learn the cranial release technique, great. Go to cranialrelease.com, click on online training program. You can register for the online training and learn this at home. And then the second part, the missing piece that everyone's been telling me, the live event. Come to the live event on December 2nd in Fort Lauderdale. And all that's on the website. Just click the live event button, or the events button, I believe it is. And we hope to see you there December 2nd. And this is going to be an every now and then event. So I'm not going to be doing a lot of them. So we'll see how this one goes. It's going to be limited to 15 students. So I will be there. Some of my top instructors will be there. You will definitely leave having a better understanding, a better application, a better way to educate people on the cranial release technique. And I'm looking forward to seeing you there. That's December 2nd. Okay, again, cranialrelease.com is the website. This is Dr. Doreste saying adios, my friends. This craniodural stress syndrome is everywhere and affects everything in your body. And most people will go through life and never receive the cranial release technique. But why not give it a try? Why not get on the table and experience this? Who knows what it's going to do? Who knows these nagging issues that you've had for years that you've just said to yourself, well, I have to live with it. Maybe you don't. Maybe it's the cranium. There's only one way to find out, and that's to get on a table. This is Dr. Doreste, and receive the cranial release technique, of course. Dr. Doreste with the cranial release technique saying, over out. I wish you all the best, my friends. I hope to see those practitioners that want to be black belts on December 2nd in Fort Lauderdale on the website cranialrelease.com. Adios. See you soon.